With us now is Dr. Maurit Beeri, the Director General of ALYN Hospital in Jerusalem and a trained pediatrician. Doctor, thank you for being with me. I want to ask about the vaccines, especially with this groundbreaking mRNA technology. When it comes to prepubescent bodies, little kids, is there something that's an extra worry about giving them the doses?
Well, we're always extra careful about children because we've learned from experience that until experience is gained, anything could be possible. But on the other hand, there's absolutely not a shred of evidence that would suggest that this should be more dangerous in children than in adults. We already know that the mRNA viruses, they do not interact with the DNA. They do not affect growth. They should not and will not affect fertility as far as we know. So we shouldn't be too worried about children. That being said, we know that side effects, for instance, are worse in younger people compared to adults, and we don't have enough information yet about side effects in children. So we're treading carefully here.
Doctor, if I can, I'd like to ask a question that kind of pushes the envelope. For now, the cutoff is 6 for this first trial. But, I mean, at this point, babies are weeks old, and they get inoculated against polio and rotavirus and other viruses. Newborns and toddlers are now getting infected with COVID. Do you think that babies, at some point, may also have to get these shots?
Again, it's early days. Right now, we still think that it's the disease doesn't affect children as badly as it does older people, unless these are very, very sick children. The number of children who actually suffer from severe disease is very, very small. So always you have to take risks versus benefits. And we're talking about poliomyelitis, of course, devastating effects on children. Same with diphtheria, tetanus. All these diseases are extremely, extremely dangerous to children. And so we start with the most vulnerable group, which is adults. I could see a time in the future where we have different mutations, different permutations of the population, and safety borders that will enable us to vaccinate children. We don't have anything specific against giving vaccines to children, as you justly said.
Yeah.
We just don't know if it's necessary yet, and we definitely have no idea about side effects yet.
In the UK right now, they're testing, children, but specifically geared towards the AstraZeneca vaccine that was developed in part at Oxford. Do you think, what would your advice be, I guess, for Israel, as Israel considers lowering the vaccine lower than 16 years old? Should they do their own tests? Should they go ahead and push forward without clear data indicating it's more dangerous for 12-year-olds or 15-year-olds?
Well, right now, the Ministry of Health in Israel has indicated that children with severe diseases and neurological conditions and heart and lung diseases should actually take the mRNA vaccine, even though there are no experiments done and we have no experience, because this is a group that was designated as a high-risk group. So I would suggest let's take it a bit slower. Let's see what happens with the Pfizer experiment in the States regarding children 12 to 16 years of age. The results will be out soon. Hopefully, we'll see what the AstraZeneca results are. And again, these are different vaccines, completely different. The AstraZeneca is not an mRNA vaccine, but we might be able to use different vaccines for different groups and populations. So because children are not a high-risk group, and the main problem is with them infecting others, my suggestion is that all the people who are eligible and available would get vaccinated as quickly and as widely as possible. Mm-hmm. And that would mean that the children in themselves would not be the carriers that would infect older people and be a danger to them.
Dr. Beeri, thank you so much for your time tonight. Great to have you on the show.
Wonderful to be with you. Have a good day.